Good morning.
All right, you need to mute yourself. Okay,
That's better.
that's better. Okay, good morning, everyone. My name is Cheryl Goldstein. I am the chair of the Sexual Assault Task Force that was convened by County Executive Olszewski last year or the year before, maybe last year or the year before. 2019, I think, to work, as a team to do a look at the county's sexual assault response system, and to conduct an audit and to make recommendations that the county would implement to improve its response to sexual assault cases. I feel like the group did a great job. I feel really fortunate to have worked with such a fine group of professionals, and it's great to see everybody back together again after not seeing people for so long. And thank you all many of you for coming here live and being here as part of the team. So before this meeting, the purpose of this meeting is really to get everybody back together again, to get an update on the progress of the implementation of the recommendations. And then at the conclusion of the meeting, The audit group is going to reconvene and conduct, one of the recommendations was to conduct an audit of 50 cases after a year had passed to make sure that we saw changes and best practices being implemented. And so we'll be doing that at the conclusion of this. As a first step, we were going to do some introductions here. So I wanted to start with Chief Hyatt. If you would introduce yourself, and also if you wanted to say a few words.
Absolutely. So good morning, everybody. Melissa Hyatt, Chief of Police for the Baltimore County Police Department. Really to the group that's before us today, and I know this is not the entire group, just thank you. I came into my role once your work was already underway, but the progress that the support and the work and the recommendations that you all have made in conjunction with the work that our team in the Baltimore County Police Department has made in our response to sexual assaults has been significant already. And I know that there's more work to be done, and we're very committed to continuing to make improvements and do that hard work. And I think at the end of the day, the most important thing is that all of this work that's been done and all the work that will be done will benefit the victims moving forward. And, while we always hope that we will have less victims that are there, we know realistically that there will be victims, and it's our role to make sure that they get the best services possible, the best investigation possible, and the best possible outcomes for them for their cases. And this work really impacts that. So thank you.
Thank you. Dave, why don't we go around and do introductions?
Okay. Good morning. My name is Dave Thomas. I presently work for the International Association of Chiefs of Police as a program director. I have I'm retired from Montgomery County Police Department, where I started one of the first domestic violence units in the state in '97. So I've been around forever, as you can tell. I've been working in the area for my entire career. I did a stint at Johns Hopkins University in the Police Executive Leadership Program, where I taught for about 13 years. Before doing some work at the U.S. Air Force with the Sexual Assault Prevention Response Office, and then going on full time with IACP about 4 years ago. So very happy to be here, very proud to be able to bring some of the expertise that I've been lucky enough to get over the years back home. So thank you for having me.
Thanks, Dave.
I'm John Cox. I'm one of the deputy state's attorneys here in Baltimore County. Just background for purposes of this, I spent 10 and a half years as the chief of the sex offense division of the state's attorney's office.
So, Brian Edwards, now captain with the police department, and we skipped Brian Rupp to my right because I wanted to introduce him to you. So I was the commander of the Special Victims Unit through the formation of this task force, and appointed by Chief Sheridan, and then continued to be appointed as the departmental representative by Chief Hyatt. And during the time that I was in SVU, we conducted the task force work. We took your recommendations and support and the encouragements, and enacted a lot of change and instituted a lot of new policies and procedures that I think really has enhanced Baltimore County's response in many, many ways for our victims and survivors of sexual assault. And in the meantime, I've since been blessed to be promoted and transferred to the Parkville precinct, but Brian Rupp, lieutenant, was selected as my replacement, and I couldn't be more pleased with somebody to come in to finish off and continue the work that the task force really enabled the Baltimore County Police Department and the SVU to undertake. The chief did mention that this is ongoing and constantly ongoing, and so in my observations of Lieutenant Rupp's taking of the reins, he has really picked up and run with the work that has already been done. Before I throw it back over to him, I do have to say, from the police department perspective, it's just been a really holistic response from the county, not just the police department. Folks in our evidence management unit, folks in our building services unit, civilian partners in the police department, as well as everybody in the special victims unit, has really invested their heart and soul into these changes. And I've not seen county government move in the way that it has in this endeavor. So a giant thank you to County Executive Olszewski and Mr. Vetter, particularly for his institution of Mr. Olszewski's vision to move us forward. So to that, I'll throw it back to Lieutenant Rupp.
I'm Lieutenant Brian Rupp. I took over for Captain Edwards about 2 months ago. I can't be any luckier to have taken over after he instituted the changes that he has. So I've sat in on a SART meeting the other day. There's a lot of partnerships that have been created with the state's attorney's office and the safe nurses, and I look forward to continuing that.
Great. Thank you, and thank you for those words, Captain Edwards, and congratulations on your promotion, and congratulations to you for taking over this very important task. My name is Drew Vetter. I'm the Deputy Administrative Officer for County Executive Olszewski. And when we created this group, the County Executive really tasked me with pulling together a group of stakeholders and experts to take a deep dive and a hard look at the issue of sexual assault investigations in Baltimore County, and to make some recommendations for improvement. Pulling together kind of diverse perspectives and groups of experts on big problems, leveraging outside expertise is an approach that the county executive has taken to any number of issues in the, I guess now 2.5 years of the administration. And I think that this effort has really been one of the most successful examples. We had a good group, we had a good process, we had great leadership with Cheryl Goldstein as our chair. I can't thank you enough for agreeing to take this on and sticking with us through it, but also because of Lieutenant and now Captain Edwards and his leadership of the unit, and really, treating the document, which we're going to go through, which is the report, as a sort of guidepost for moving forward, and really not just shelving the recommendations, but acting on them, and making improvements. So we're encouraged to see that progress, encouraged to provide the updates today. I would also be remiss not to acknowledge my colleague, Lisa Morris. For those watching, you can't see her on the camera because she's sitting underneath of it, keeping everything running here. But Lisa was instrumental in helping to staff this work group, and did a lot of work to help coordinate the logistics for today, which are particularly challenging given that we're still in a pandemic. As you can see, we've got the staff of the police department and members of the work group here physically, but in an effort to limit the number of people in one space and coming into the building, we've made this available for live stream for members of the public to view. I also believe that the recording will be, it's recorded, I believe, and that'll be available on the county's YouTube page, and we'll link to it on the Sexual Assault Investigation Task Force landing page on the county website as well. So again, a big thank you, and I'll turn it over to Sharon.
Thank you. My name is Amanda Rodriguez. I'm the Executive Director of Turnaround. I am replacing my predecessor, Rosalind Branson, who I know did amazing work on this task force. And by way of background on me, I was a county prosecutor for many years, and got my start there, and then moved into policy work related to anti-trafficking efforts and anti-domestic violence efforts, and have the benefits or the honor now of coming back to Turnaround, and working directly with survivors and allowing their voices to be heard. So I am absolutely honored to be here and to be a part of this effort. I have read everything. I am excited about the efforts that have been made, and so many of you have come to me and asked for input and involved Turnaround in the steps that you're taking and moving forward, and also included the voices of survivors in some of those efforts. So I applaud you for that. And I'm excited to see how we can move forward and continue to reevaluate and ensure that we don't sit, that we continue to make better and better strides for our community. So thank you. And thank you, Cheryl, for your continued your guidance, and certainly your, I really applaud that we came back to the table to say, where are we now and how can we keep moving forward?
Nadia? Good morning, everyone. My name is Nadia Benaisa. I use she, her pronouns. I'm the co-founder of We Believe You, the student activist and advocacy work for survivors of sexual violence, interpersonal and relationship violence at UMBC. I did graduate last May, and I continue to serve as chairs of Inclusion Council committees, as well as a founding member of UMBC's Inclusion Council, working, to progress social justice work and also to continue to advocate for survivors where I can. And I was an original member of this task force, and it was a great experience, and I was really happy to be able to help and be there for folks my age and fellow survivors who have, been on the opposite end of some of this work and had varying experiences. So it's been, a privilege to be here, and thank you for bringing us back so that we can continue doing this work, since we know success is never final, and there's always more that we can be doing.
Congratulations on graduation. It's great to see you. We were just talking, when we were putting together the PowerPoint, I said, didn't you graduate? So congratulations. Thank you. It's great to have you here. The one task force member who is not with us live today is Laura Clary from GBMC. She will be joining us for a short time to talk about a couple of the recommendations, but she has other business that she has to attend to at the hospital. So she'll be joining us virtually. We have a few other folks in the room. It'd be great if you all could just introduce yourselves.
I'm Carl Zimmerman. I'm Chief of Staff for the County Police Department.
Good morning. Captain Scott Keenter. I oversee the Criminal Investigations Bureau, Persons Crimes, which the SBU falls under.
Thank you.
And I should mention, with Captain Cantor being present in the room, the task force recommendations put a lot of onus on the police department for changes, resource reallocation, and so forth. And Captain Cantor took over for Captain Chris Kelly. Captain Chris Kelly is now Major Chris Kelly, and he was a tremendous partner and support in this. Captain Cantor continues that work, and I think that's evidenced by him being in the room to witness this. Major John McGann, who has been the commander in CIB all the way through this entire process, has also been a tremendous support and given a lot of leeway to sweeping change, and has provided all the resources we need. So I thought it should be mentioned that the command staff has done just a tremendous job in supporting the SVU efforts, up to and including our now Colonel Andre Davis, who has taken a keen interest in the investigations as well. So,
And then there's one person behind you.
I am off camera. Sergeant Joshua Watson from the Police Technology Unit, assisting with the technical resources for today.
Thank you for getting us set up. We appreciate you.
Thank you.
And good morning, everyone. My name is Sabrina Chase. I'm calling in from the Office of Law. I'm the Deputy Chief of Transactions.
Great. Thank you, Sabrina.
So I think that's everybody, right? All right. So let me just talk a little bit about what we're going to do today. So the agenda for today is first, we have a PowerPoint presentation that we're going to project that's going to be available for everybody who's watching the live stream and for everybody in the room. The PowerPoint itself has each slide has a recommendation and then has bullet points about what was taken or seeks input from somebody who was on the team. And Brian Edwards will primarily be walking us through that because many of the recommendations were police department involved recommendations. After we get through the PowerPoint and go through the recommendations, we will be having a discussion among the group. If anybody has any questions, any feedback, any thoughts, any concerns, we'll have that discussion. And we will also open it up for questions from people on the live stream. The way the live stream will be done is through the chat box. So if you've got questions, even as the presentation is going on, if you have questions, please put them in the chat so that we can start collecting them and be prepared to respond to them at the conclusion of going through the recommendations. Once we have done that, I will then be making a motion to close the meeting so that the audit committee will be able to do the audit. I think, as we all know, and for the public's benefit, the audit process involves looking at confidential files and confidential information from victims and potential suspects. And so that is something that we do in private and not in public, but we make the results of the audit public. So we'll be talking about that later, making a motion to close the meeting, and then we'll conclude. So that's sort of the roadmap for today. Does anybody have any questions about that before we get started? Okay, so I'm going to ask Captain Edwards to get us started with the presentation about the recommendations. And just so everybody knows, I believe at 10:30, Laura Clary is planning to call in, and when she does, we will be kind of skipping around just to make sure she can tell us about the recommendations she needs to comment on.
Give me 1 second because I'm trying to control the computer next to me with the wireless mouse. So I do want to just preface the presentation with the fact that this is an encapsulation of the police department updates to the task force recommendations. Since we were the focus of the majority and the bulk of the recommendations, I wanted to create a format that we could follow along here. But I certainly do not want to speak for any of our partner agencies. So just with that disclaimer, I'll move forward with each slide will have the task force recommendation at the top. And the first is that the Baltimore County Police Department should draft and implement a comprehensive sexual assault investigations policy to govern all sexual assault cases. This policy should be modeled after the IACP models, which is the International Association of Chiefs of Police, and the Baltimore City Police Department's policy, especially as they had already gone through this sort of examination and then was re-examined through the DOJ. So there was a lot of validity provided to both of these model policies. So for the police department update, Special Order 2021-01, Sexual Assault Investigations, is a very comprehensive departmental-wide policy. So a special order, to explain, is something that goes out to every member of the police agency. Whereas later you'll see a standard operating procedure affects a specific part. So the special order addresses every rank and every discipline within the police agency. It's been used to teach off of, to permeate the agency with best practices, with the culture and the paradigm shift of trauma-informed, victim-centered, and offender-focused investigations. And it really launches so many of the task force recommendations in many different ways. It also enacts legislative requirements that have come along even since the task force recommendations. There's been multiple legislative initiatives that have added more specifics than the task force had added. In addition to that, the Criminal Investigations Special Victims Unit has enacted a standard operating procedure. Again, that is specific to the Special Victims Unit and sets policies and procedures specific to them. And it's built upon the best practices documents as recommended. Recommendation 2. This was one of the very first initiatives, and Cheryl, I have to applaud you for your boldness and your insistence in getting to work on this right away. So our victim interview room has really turned into, I really view it more of a suite and a survivor suite. The county government came together on this task and accomplished this very quickly with year-end budget money, with the director of building services literally getting in the car with a designer and going to a store and purchasing these items. They became very personally invested in this process. So Linda Abel and Deb Schindel, especially, I need to appreciate their efforts here. But this room, the thing that is so special about this room is we've got to witness victims and survivors walking into this room and literally being taken aback because it was not anything they imagined when they walked into a police facility. That it was comforting, it was welcoming. I believe it communicates that we care, that you're safe. And it's one of the first steps along the way where we empower them to make choice, up to and including typically when you come in a police facility, you're told where to sit. And there's a wide variety of seating options. They're empowered to choose where they sit. There are handmade blankets that are made by some nonprofits that victims can take with them. Inside of that closet are some essentials, some clothing, some getaway type items if somebody needs to flee their living situation, refreshments, snacks, a refrigerator. And a special note, that barn door, I've never seen a barn door in county government. And that was handmade by Joe Clary, who is Task Force member Laura Clary's husband. From the GBMC SAFE program. He made that door, specially designed it for the room and custom fitted into the room. This room is audio video capable. That was another best practice that the police department instituted, which was knowingly to offer to victims to have their statements audio and video recorded. And this was best practice that was vetted through the state's attorney's office. There was actually a white paper produced nationwide that stated how this could be best practice. And it's an attempt to prevent victims from having to repeat their statement over and over and over in trial preparation, in another round of investigation, or even defense attorneys' preparation for trial. The hope is that a good and complete and accurate audio-video recording encapsulates some of the trauma-informed nonverbal behavior that is just very compelling when you see it in its raw form, and speaks for itself and can be evidence at trial, and also to capture the statement in its raw form, not interpreted through the human interpretation of a police report. So this room is really just a tremendous accomplishment. Thank you, Cheryl.
Yeah, I was going to say, I think to me, this room is sort of an example of how the county and the police department has taken recommendations very seriously. You know, I think first of all, the rooms, they set the tone for the entire encounter, really, with the survivor and other witnesses and family members. But also, I think it's a real testament. I mean, you know, you tell a lot of places to make their rooms nicer and more welcoming, and they get new furniture and they give it a paint job. I mean, you guys really went all out to do everything you could to make this space, you know, a safe, feeling, welcoming, comfortable space. And I think it's emblematic of how you've approached the entire process. So thank you very much.
Thank you. And a special thanks really does need to go to Mission 14 as well, which is a nonprofit organization primarily focused on affecting and impacting human trafficking. There's a lot of overlap, obviously, with Special Victims Unit. And so a couple key notes in here, and I'll mention it in the next slide. The wall color is a color that Mission 14 uses in all their rooms, and it's North Star, and it is a tribute to Harriet Tubman and her use of the North Star in freeing slaves and taking them to freedom. There is a bust of Harriet Tubman, also known as Araminta Ross, if you have heard of the organization Araminta for human trafficking. She is in the room. I think that Mission 14's involvement also has brought in some of the handmade blankets, weighted blankets, and so forth, and continues to provide some of the comfort care in that room. I think we've covered most of that.
I add that having the recording capabilities that you have in there is an incredible asset, in that it allows the investigator to connect more with the victim. They can concentrate on that conversation rather than being taking notes at the same time and going through the interview. So and making that connection, as hopefully everyone knows, is building that trust, building that rapport. And I mean, it's an incredible asset.
And thank you. The real practical use of it has also even led to not only the detectives being able to put down the notepad in the room, like you said, to establish a rapport, but for fellow detectives, the team, to be able to watch. And if, let's say, a suspect's name is mentioned, or an address, or a vehicle description, the team in the other room can be working on that information rather than the detective getting up, disrupting the conversation, and coming back.
Absolutely.
It has worked to really enhance the rapport that needs to be built in these interviews. Thank you for mentioning that. Outside of this room, there's a hallway so that we can kind of insulate it from sound. And this is the hallway that detectives take from the general hallway on the screen left on the first photo to the SVU office, which is screen right. It kind of creates a buffer and a suite to that victim room. It's really hard to see in that first photo. There's an odd little section of the wall, which is why that tree looks a little distorted. But this idea of the survivor tree is something that we wanted to bring together for multiple reasons. You actually, in the envelopes I gave each of you with the department or with the unit coin, there's also some blank leaves. I'll explain to you the use of those. This tree was designed to be a dark silhouette of the dark skies that run through all of our lives. And then the leaves are meant to be similar to the Stand Up to Cancer campaign, where you can memorialize or remember anybody that has impacted you in your life that's a victim of sexual assault. And what we did was, again, trying to permeate the agency. As we taught in service last year, we talked about this concept. We passed out leaves and we collected them from our officers. And so this was for people in their life, people who in their employment or in their job here, or even themselves could join our tree. And I will tell you, one of the most unanticipated and most moving things was opening up those envelopes every week and seeing the number of our own officers, Baltimore County officers, who were victims or survivors of sexual assault themselves. And so the one photo you'll see here, there's 2 leaves that say me. This is intended to have them remembered, but also to ground our own detectives as they come and go every day in a very wearying world, why they're there, and reconnect them to their calling. So after this, I'd like to show you guys this suite if possible, but also collect any leaves from you if you would like them to join that wall.
So I think Laura might have just joined.
Oh, excellent.
She.
Is Laura in the room? Are we able to?
Unmute her.
So actually, she looks like she's on as an attendee and not as a panelist, so I'm not sure if she'll be able to speak.
I'll fix that.
Yeah. Can we?
So Laura, we're working on bringing you in as a panelist. Just to finish off this room, we also differentiate our own victims and survivors with butterflies, so that when they are with us, they can join that wall and not feel alone. The tagline of "I am a survivor" with the 3 dots leading up to it is everyone has a different story. We don't assume their story. It doesn't factor into what happens when they come in the room, but when they leave, we hope to help them be on a path to being a survivor.
Hi, everybody. Can you hear me?
We can.
Hi. Sorry for being able to just pop in briefly. So I'm currently teaching the 40-hour forensic nursing certification course to train the nurses that are going to be joining the GBMC SAFE program, as well as helping other programs in the area. So it's a busy week.
Well, thanks for taking a few minutes out of your busy schedule to join us today. We really appreciate it. I know, we had hoped that you could give us some feedback on recommendation 22, and I know you don't have a lot of time, so we wanted to let you jump in and do that while you're with us.
Sure. So as the chair of the Baltimore County SART team, I have kind of connected with some key members, and we have discussed kind of creating a subcommittee that will be responsible for doing these case reviews. So I've spoke with representatives from the state's attorney's office, victim advocacy, forensic nursing, law enforcement, and really just creating something that when we do these case reviews, we have every discipline at the table, and we are very much open to that.
And so just, to clarify for anybody else who might be on the call, so, we did this audit process as part of the task force, and we're going to do a follow-up audit process today, but then the goal would be that the SART, which is the sexual assault response team here in the county, would take over the function of doing case reviews, so that the team itself would be looking at cases regularly and identifying if there were any issues or concerns, or if things were going well, and if there were any adjustments that needed to be made to practice. And so, you and your role as the SART chair will be leading up that process going forward.
Yes, that's correct.
Great. And do you have any sense about when you would start doing case reviews, or how, what kind of episodic or periods how often you would do them?
So we haven't discussed that. COVID really threw a wrench into things, especially with being able to meet face to face. I really feel like case reviews are something that you'll have to do in an in-person environment. So making sure that we're able to have space set up to do these case reviews while still maintaining the CDC guidelines for social distancing. So that's something we're going to have to talk about, where we're going to be doing these so that we can still be face to face and still be, safe in the same room together. I would like to start sooner than later. And I think that, all the members of the team are very open to that as well.
Great. Thank you, Laura.
Thank you so much.
Should also be mentioned there that there is a provision through the Attorney General's office, the Sexual Assault Evidence Kit Committee, which enacts some federal legislation. If a victim is not satisfied with the outcome of their case, particularly as it relates to the testing of a safe kit, that the SARTs would have primary responsibility to review that case and make recommendations And then that committee would have secondary views. So there are actually going to be multiple components that the SART will play in case reviews. And that's actually legislated to be ongoing.
All right, so do you want to pick up where you left off?
Sure. So the other recommendation was the office space and interview rooms, and it should just be noted that a significant construction project was conducted. The space is professional. I remember reading a New York Times article where an SVU detective in New York describes being in a broom closet in the basement, and our previous office really was old, closed in, no windows. Became almost a den that people didn't really want to go into. And we do have a bright new open airy office space. The county invested significant amount of money and time and design into that, and it really has created a much more professional space for the detective. So just one view of that space now. Recommendation 3 was probably the softest recommendation to the police department out of the task force, and it continues to be considered because there's so many implications. Having cases of sex offenses where the victim's under the age of 16 investigated in the CACU, which is the Crimes Against Children unit. So the CACU is the police department term for that unit, and then the CAC, which is the Child Advocacy Center, is actually the multidisciplinary team that governs the investigation of these cases. There are specific legal exceptions when a victim is 12 and under that create a clear 12 and under line that is observed. And then there's some gray area between 13 and 15 that those special exceptions don't apply to. So the police department has to decide where to house these cases, although the CAC is governed by a board of directors. So this has been fully vetted through them. They've issued, the CAC leadership team has issued some recommendations that if they were to take them on, those cases, what resources they would need. If the cases remain with the SVU, what resources they recommend the SVU put in place. And they're presenting that to the CAC board of directors actually later this month. So in the meantime, these cases are continuing to be investigated, and we are adding the types of services and input that the task force had recommended. It's just, at this point, it becomes simply a staffing issue of where to house the investigations. If the cases move to one or the other, the resources will go with those cases. So that's ongoing. Recommendation 4 was Baltimore County should consult with a national training expert to develop a multidisciplinary training team. And Dave Thomas, who sits here, is a nationally recognized training expert. He also referred us to retired Chief Tom Tremblay, who he has his own consulting company, but he also does a significant amount of work with IACP in this area. We were able to meet with him personally when he was in town for a training in Montgomery County hosted by MCASA. And then as we co-hosted him in a training here, we developed a comprehensive list of topics that need to be covered in any training plan. And we've gone out and sought those components in various different trainings. We actually continue to work, and actually Dave and I were just talking on the side to develop a statewide consistent training that enacts all of this. MCASA is excited to join in that. The Attorney General's office has reached out to the Training Commission to enact that as well. So to take these components and bring them together in a comprehensive course. Dave just said that the DOJ is about to publish a curriculum for trauma-informed sexual assault investigations. And so we're now looking at pulling that into the course. So in the meantime, with this training plan, as we've sought these training components in multiple places, the previous report of final findings and recommendations listed an awful lot of what we have already done and continue to do, and that can still be found on the Sexual Assault Task Force website. And we continue to seek accreditation and development of an MPCTC course, as mentioned. During the initial phase of COVID, which is when we were scheduled to attend some of these nationally recognized trainings that got shut down, we actually identified 80 hours of instruction on EVALI's Online Training Institute, which is just a really great online resource. It really does require you to learn the material. The test is an adequate test to show that you did learn the material. We were actually able to reduce our workforce that stayed in the office to reduce the risk of COVID. and have our detectives complete these 80 hours of training virtually. And it really actually turned out to be a great kickstart to the year's training. One of the other recommendations was particularly as it relates to intellectual disabilities. And we partnered with Pathfinders for Autism to develop a 2-day course. One was classroom with experts in the field, and the second day was practicals in the field at some of our neighboring schools, where detectives worked through particular challenges with individuals with intellectual disabilities to work through these issues. So it was a really valuable training. Everybody in SVU has attended, and we plan to continue that training in the future. Recommendation 6, I'll refer this to John Cox. It was for the State's Attorney's Office to benefit from training in the areas of interviewing victims with mental health issues, other disabilities, investigating and prosecuting sexual assault cases where the victim's under the influence of drugs and or alcohol, and best practices for investigating and prosecuting cases where there's delayed reporting.
And we caught Captain Edwards making a slight mistake. It's recommendation 5 still.
I'm sorry, recommendation 5, thank you.
Chief don't notice that. He's been perfect otherwise. Obviously, an event happened in our lives that has constrained our ability to get a lot of, or to continue with a lot of the training that we had done to that point. The report itself contains a long list. Obviously, the training was ongoing as before and during the course of the task force activities, and so a long list of a lot of those trainings are already in the report. I then reached out to try to find out an update to what we've been doing since. And as I said, we've been to some degree inhibited by COVID. But just as examples, the Goucher training, I think it was mentioned in the report itself, and we obviously attended that. There was also, we rounded up some virtual training. There's, for example, one of our assistants was in an alcohol facilitated sexual assault training back in May of last year. The human trafficking work group is relatively active in providing training. So we had a number of trainings as attended, including just as an example, understanding complex needs of victims. That was that was actually just the other day. Before COVID started, one of our assistants attended a San Diego conference that included, amongst the other pieces of training, trauma-focused investigators or prosecutions, and then mental health issues with regard to victims. So our efforts will continue as long as funding provides us the opportunity, and presumably when things open up a little bit more, so there can be personal assessments.
On to recommendation 6.
There you go.
There we go. Thank you. So Baltimore County Police Department should develop and implement a uniform and centralized record system for sexual assault cases. During the audit, they found that the task force found that documents existed in multiple locations, including both computer and paper files. Should be one complete case and case file, and case documentation should be in uniform across all case files. Should be standardized coding protocols for the status of cases. During the case audit, they found that case files were coded differently than the final UCR code. So a lot of this actually has been a lot of in-house house cleaning, if you will, when it comes to the records management system. We obviously were migrating from a complete paper system to a complete electronic system. That has continued to shift. We've gone to a new product called Premier One, which actually now allows for detective notes and for electronic investigative files, whereas before the previous electronic RMS did not. There are still some considerable, developing trends in law enforcement, and that's the burgeoning electronic storage that goes along with cell phone records, video storage, and so forth. So our RMS does not accommodate those files, but the police department has continued to expand and then standardize its electronic storage, whereas before we were kind of figuring it out as we went. It's now it's been studied and developed in a comprehensive way. So our case files themselves in SVU, we have a standardized format with a standardized table of contents. Every case file contains that and is contained in that order, even if not every section is populated. There's also a standardized tracking sheet in the front of every case file that maintains a list of ongoing action items when they've been completed and provides for a place for supervisor review and or comment and reassignment. So there's really been a lot of improved housekeeping. when it comes to those records. The new RMS also utilizes the new UCR reporting standards of NIBRS, which is a little bit easier to be able to code correctly each individual underlying offense in a case. So I think we've made some very good efforts in this, and it continues to evolve with just the expansion of everything to electronic storage. So, John, recommendation 7, refer to you.
Okay, and recommendation number 7, it's obviously there without going through in particular details, but the recommendation primarily is to having all sexual assault cases reviewed by the Sex Offense and Child Abuse Division of the State's Attorney's Office. Just a little bit of background in terms of our office structure. There is obviously a Sex Offense and Child Abuse Division of the office with a number of attorneys assigned within that division itself. They are primarily responsible for the review and determinations and advice to both the police department and determinations on charging and the prosecution of sexual assault cases. There are, however, several of the divisions that are involved in that area on occasions. Number one being our juvenile division. So if a juvenile is being pursued for a sexual assault, that would be handled by our juvenile division. Charging decisions and then prosecution would be by that division. In addition, we have a domestic violence division, and obviously sexual assaults occur during incidents of domestic violence. And with the factors that are relevant to domestic violence, it's certainly our determination that it's more important that the domestic violence prosecutor be handling cases of that nature. So as a part of this recommendation, the concern was making sure that reviews, charging decisions in particular, are done by somebody with particular experience in sexual assault. So in addition, in terms of our office structure, people move within the office. So we have the advantage of individuals with experience within the area of sexual assault who may be elsewhere in the office at the time. It happens right now that the chief of our juvenile division is a former member of the sex offense division. So he has the experience and the knowledge to be able to make those appropriate decisions. Our domestic violence division right now doesn't have somebody who's been within the sex offense division. So the way we've structured, and I just confirm that it's still happening, is that anytime there's a decision being made within the domestic violence division concerning sexual assault, they will consult with the attorneys, primarily the chief of the sex offense division, in making that decision. The only exception we've made is if, I hate to say it in a crass way, if it's a no-brainer and there's no question the case is being charged, then that consultation doesn't appear to be necessary. But when we're looking at something where there is either a difficult or a contrary decision, then that consultation will occur.
Thank you, and I believe recommendation 8 comes back to you as well.
And back again. So this was a recommendation that the State's Attorney's Office should review the best practice information provided by the task force and institute policies consistent with those. As it points out in the recommendation, there are no existing written policies regarding the investigation and prosecution of sexual assault cases within the Baltimore County State's Attorney's Office. And you should give consideration to doing that. We have given consideration to doing that, and to be perfectly blunt, after consideration of all the factors, I don't know if anybody else in the office sat down and read all of those best practices, some of them incredibly voluminous. And the decision was made by the office that we would not do that, and we have not done that. It is frankly our belief that a best practices procedure guideline is either going to be so vague that it's going to be not of any benefit, or unfortunately too specific such that you're going to have to vary from it on occasions. We have a lot of faith in our ability to pull on our experiences within the office as to how to handle any particular investigation and or prosecution. For background purposes, the currently elected state's attorney, Scott Schellenberger, back in his earlier career within our office, was the chief of the sex offense division. His other deputy, Robin Coffin, was his second in that sex offense division prior to moving elsewhere within the office. I, as I mentioned earlier, spent 10.5 years as the chief of the sex offense division. There are a number of other attorneys who've been active in sexual assault investigations and prosecutions all around the office. So all of us have what I believe to be a significant amount of experience and knowledge within the area, such that our ability to address individual cases and address those individual issues is the best avenue to take, and that's what we've chosen to do.
And I believe recommendation 9 is back to you.
Okay, and recommendation number 9 is a requirement, basically is what's referred to as a staffing form. What we found during the course of the task force itself, and the area that was being enveloped by what the task force was looking into, was that the creation of that staffing form in effect occurred in the middle of all of that. So we had a lot of circumstances where there was no staffing form, and then it was happening as the task force was active. Just for lack of a better explanation, a staffing form is a form now that is utilized all the time, in which if there is interaction with law enforcement, if we do this through the CAC and also through SVU, if we are being consulted with about a particular case, then we create this staffing form. And it has information on it concerning the particular case, the details that have been provided to us, and then what, if any, recommendation we're going to be making. It has significant advantages in that we can then refer back to it, if something has resurrected or something along those lines. It's an unfortunate reality that we've dealt with the efforts to try to get our staffing forms, which causes some concern because of the material or information that's inside of that. But I think we have every confidence that it's appropriately protected at this point. So the bottom line is we are and will continue to use the staffing.
Recommendation 10 comes back to the police department, and this is specifically that it referenced our biology unit and filling 2 analyst positions. And I can tell you, in the time that the task force made this recommendation, and then with Chief Hyatt and particularly Mr. Zimmerman's efforts, we did move forward in filling an interim forensics director position with the new forensics director, Rachel Lucas, who she has really, I think, bolstered so many of the processes, some of the resources provided within forensics, and also a culture change to the point where I think a lot of the folks that work there feel very valued and very much a member of a team. And I think we've seen a tremendous difference as end users of our forensics unit as a result of that hiring and so many other things. This also did mention seeking funding for untested kits. And we've sought funding from multiple different sources. The Hackerman Foundation, which is a local organization right down the street here in Towson, kickstarted us with this, with a partnership with then Delegate, now Senator Shelley Hettleman, and the County Executive's Office to bring in money for outsourcing of old untested sexual assault evidence. We continue to apply, and the forensics unit did apply for it, and it has been awarded. It's pending county council approval next month, I believe. Over $200,000 for a 3-year interim position for personnel to assist in the monitoring, tracking, and reporting of untested kits and safe kits. And then the Special Victims Unit, really building upon the legacy that the Hackerman Foundation intended to start. We applied for the Sexual Assault Kit Inventory Part 4 grant from the federal government. Dave Thomas and I were speaking of this earlier, that he does an awful lot with work with SACI. Part 4 is specifically designed for cold case sexual assault and sexually motivated homicides. And we have a really unique position here in Baltimore County to have almost 30 years worth of cytology samples stored at GDMC, which were in essence the predecessor to Safe Kits. And we are systemically working through analyzing, intaking every one of those cases and submitting those that are appropriate for testing. And we've actually have some very exciting developments that are coming out of that. And that was, that grant is $288,000. Along with each of these grants, there's so many other peripheral costs to conducting these programs. I didn't include those dollars. These dollars here are specifically towards the testing of kits. Recommendation 11 Crime Lab to adopt policies for retaining and testing safe kits. Different agencies house this differently, and so the semantics of it being the Crime Lab is a little different. The police department itself, and then enacted through a CIB SOP, we have adopted the Maryland state required policies under Crim Pro 11926. We actually have more restrictive retention on top of the state mandated requirements. So we've satisfied this requirement through policy and through practice. Recommendation 12, developing a centralized method to inventory and track safe kits. And this was kind of going on at the same time. The Maryland Attorney General's office was awarded Part 1 and Part 2 of SAKI, which was to inventory the statewide inventory of safe kits, identify those that are tested, partially tested, or untested. And then the state, again, as a statewide grantee, is moving forward and testing those. So as part of that, we had to undergo an audit from the Maryland Attorney General's Office SAKE Committee. We recognized that it would be much easier to pass this audit, but also to have a better understanding of our own safe kit inventory if we moved safe kits from the general evidence storage into a co-located area. We had to identify space, alarm that space, make it evidentiary capable, and we did, and co-located all of our safe kits, inventoried, captured a lot of data that was not otherwise captured in one central location. We started building it. It's a really comprehensive spreadsheet now. And in the process, the Attorney General's office asked Jeff Ray, who you remember from the audit, to join in these efforts to develop a statewide program. And Jeff has really become one of the advisory members to the state for the state's future development of a statewide tracking system. The nice thing there is everything that we dream up of that should belong in the state tracking system, he's able to then populate into our spreadsheet so that we can migrate the data right away. So we have gone to the point of being probably a model organization with how we store and track the safe kits at this point. That's all described there. Number 13, Baltimore County Police should work with victim advocacy organizations. So it mentions turnaround, but I'll give a brief report and then turn it to Amanda. So we have worked directly with GBMC Safe DV program. They have an advocacy portion of their program. And Turnaround is the Rape Trauma Crisis Center for Baltimore County, who provides advocacy as well. So the way our advocacy attaches is when a safe nurse is called in from home to consider conducting a safe, an advocate comes in from the program as well to attach an advocate at the hospital. Not all cases go that route, so we also have to seek long-term advocacy and community partnership, which is where Turnaround's advocates attach. So the protocol and the procedures exist. COVID certainly threw a loop for this. I think we've done a great job of adapting to being able to respond and continue to provide services, even though Turnaround is now virtual. We create some virtual environments that we can attach. But we have a direct pipeline while we are working out what the long-term protocols would be. Of course, with that comes staffing concerns. We have a lot of work, unfortunately, to ask Turnaround to do. And as we move into these GBMC slides, we have even more work to ask you to do. And right now, we have a direct pipeline to Amanda and some of her tremendous staff to be able to attach advocacy. We'll move towards a long-term approach, and maybe you can speak to that.
Yeah, absolutely. Thank you, Captain Edwards. So just by way, I started in December of 2019 and COVID hit 3 months later. I would say the first 2 or 3 weeks, then Lieutenant Edwards and I were meeting and talking about that pipeline that he mentioned in terms of making sure that we had a direct connection between the detectives working on the cases and their counterparts in our office, the case managers and advocates, to make sure that any individual who's experienced sexual violence and had connected with law enforcement could then have access to an advocate immediately. There was discussion, and there continues to be discussion, of how we can make that essentially a best practice, even things that perhaps are not being done in other parts of the state, looking at innovation and some things that I'm really excited about, even co-location potentially, or having an advocate available immediately upon law enforcement going out, which I think would really change the experience potentially for a survivor to have access to that advocate right away. So all these things, again, are in discussion and we're really excited about them. But I wanted to highlight the impact of COVID on advocacy groups because it's been significant. In terms of a number of sexual assault survivors, those who experienced sexual assault that we've served just during COVID, there were 147 in the county alone. And so we have, in terms of positions within the agency doing advocacy work, I have a third of one person and half of another that serve the county in terms of sexual violence. And so I think that it is a resource question, and we are going to have discussions about pivoting resources and looking at the needs of the county and how turnaround can be as responsive as we possibly can be to what the community needs, to what our partners need, because we certainly want to show up in the way that is the most effective for both our partners, but certainly for the community at large. And so we're really excited about what the partnership can look like, how we can continue to be as responsive as we possibly can be, but also keeping an eye on that resources are what they are. And looking at the numbers, I was hoping that we would have a peak and then we would see things start to come down. And unfortunately, or fortunately, I think people have more access to us now because we were very mindful about making sure we were getting the word out about the services available at Turnaround. And so the numbers are not coming down. We are just seeing continual increase in need in our community. So that means that people are getting access to us, which is a good thing, but it means that we have to continue to be as responsive as we possibly can be, which means just adding to the internal structure and growing to make sure that we're responsive to the community need.
And I want to recognize and let the folks in the room know, I've had an inside view of how much work goes into what you provide at Turnaround and the adaptations you had to make through COVID. There's a group called Safe Futures Baltimore County, which Turnaround helps chair, but that draws together all of the regional and specifically county resources that go into domestic violence, sexual assault, human trafficking, and child abuse. And the pooling of resources and the cooperation between the somewhat competitive groups, if you will, during COVID has really been tremendous, and I think is going to have some long-term impact. The sharing of responsibilities and particularly being able to institute your chat feature during COVID-19. This has been a discussion for years with significant hurdles that seem to be in place, and COVID has helped us tear down so many of these hurdles in ways we didn't imagine. And I think the chat feature for your organization to be able to have anonymous or quiet and silent covert reporting is a tremendous thing that your organization did during COVID. So.
Yeah, I appreciate you highlighting both of those things. So the one is we have incredible partners in the county, other victim service agencies, and we have all, we're all competing for the same dollars, so it becomes competitive, but we have all come together through this incredible time and certainly have ensured that, I would say, one of the places that we come together is around housing. We have made sure that any county resident that is experiencing domestic violence, sexual violence, that needed housing has it. And I'm really proud of the group that came together to do that through Safe Futures Baltimore County. Turnaround does have a 24/7 hotline for anyone that needs assistance. We also have a text line that we launched during COVID related to crisis. If someone is unsafe and cannot call because their abuser is in the home, they can text us. The other thing that we are launching in May is, again, kind of as a result of that Safe Futures Collaborative, which is a statewide model, is a crisis response center of sorts. It's not an actual physical center, but it is looking at best practices across the country and bringing those to Baltimore County and City and making sure that there's evidence-based practices in terms of crisis response that first 72 hours that we are, again, what I'm really excited about is that we're going to be able to highlight the very best for our community here in Baltimore and making sure that they have what all of the nationwide centers that have been doing this work for a long time, we're going to be able to bring it and center it here and show that it works. So things like emergency shelter and that 24-hour crisis response, like it's going to be hopefully the best that we've seen. And so I'm really excited to be able to bring that. We're hoping to launch that in May. So.
Excellent. And an exciting piece of that Safe Futures is not just the crisis response piece, but also the prevention and education that I think is so important. I also want to note, Mr. Vetter, the county executive's office did a tremendous amount of work through COVID with a nonprofit engagement committee. I'm sure you're aware of it, but for the public to be aware, bringing together private dollars into the public realm to be able to engage with groups like Turnaround and Dove and Family Crisis Center. And particularly One Love was also brought into that for education and prevention pieces. The food distribution groups being able to get pamphlets and distribution and a crisis type resources into the food bags that were being given out into, and to try to get that information into the homes of those that may be stuck in abusive or assaultive situations. I think the county, the police department's leadership, certainly along with the county executive's office, really came together to create some innovative ways to outreach to sexual assault, domestic violence, human trafficking, and child abuse victims throughout COVID. So. 14, the immediately cease usage of the waiver forms. So a waiver form was a form that was being used in previous investigations if a victim expressed reluctance in proceeding with a police investigation or prosecution. And the form, I had spotted that it had developed in some form or fashion in the 70s as a handwritten. It almost took on a life of a detective wanting to document that a victim didn't want to move forward so that they could tell their bosses that, hey, don't hound me on this case. Well, it took on a real life of its own to the point where it became a real hurdle to the relationship, the rapport type relationship, Dave, that you mentioned early in an investigation. And it almost became a bright line for detectives to say, our victim signed a form, I'm not supposed to contact them. It just took on a life of its own that I don't think anybody ever intended. So many different places came together, including Maryland Coalition Against Sexual Assault. We had our own internal examination of this form already going on, to the point where we did cease that practice in 2019 before the recommendation was made. But we joined in with MCASA's writing and drafting of legislation. Scott Schellenberger was able to help fine tune part of that legislation through feedback with Lisa Jordan, the director of MCASA. We did cease that practice. We actually helped write the best practices document that was used to enact that legislation. And I think most importantly, we kind of did an informal statistical analysis. Captain Kelly and I sat down and did this a few months after the practice, and what we noticed was a real marked increase in victims remaining involved in the early phases of investigation. Really difficult to quantify and get solid numbers because there's just so many factors that go into a victim's willingness or wanting to continue an investigation. But the key point is here we recognize that they stayed with us through the initial investigation, and I really do think the ceasing of the use of that form was really instrumental in that.
Yeah, and I just wanted to sort of add for people who don't know this, I mean, this is not a Baltimore County problem. This is a national. You see this in departments everywhere, and it evolves very much, as Captain Edwards describes, which is, victims are reluctant at the beginning sometimes. And so, an officer or detective wants to make sure that it's documented, but the document had over time does take on a life of its own and becomes problematic practice. And so, but we see this lots of cases.
And many times it's an implicit or unconscious way. And we start doing things because we've been doing it that way all the time and everything, not realizing the repercussions of traveling down that road. It's real easy to say, okay, well, we can, Montgomery County used to be 786. I'll move into 786 and go on. It was like, whoa, put the brakes on and start looking back. You're like, you know what? You should have hung in there, put that time and effort necessary to gain that rapport so that you can have the victim participate. So that's commendable.
And I appreciate what you mentioned there with the implicit. I think it really bears repeating, and certainly I hope if any of the detectives that have worked there or are working in SVU hear this. I think this form created a situation where they were uncomfortable and they felt in an awkward position. And in some ways, they became painted as doing something wrong when they were doing basically what we had taught them to do. And so some of the very early conversations before I ever spoke to MCASA about it were from detectives saying how uncomfortable they were with us for. So I do think it bears repeating to them and to the public that the detectives working there are also very appreciative of the task force's recommendations and giving them finer tuning to their policies and procedures. And I think they really feel empowered and enabled and much more attached to their calling through things like getting rid of this form.
And now what we do, I don't know if it's in this slide or not, but within 30 days, as long as if the victim does not wish to go forward, we ask the victim if they would be okay with us following up within 30 days. And a lot of times we have a separate investigator call them, many times a supervisor, just to see if maybe they would be more comfortable talking to someone else. And we have gotten some people that have come forward, especially in the domestic related cases that have said, yeah, I would actually like to talk about it now. So.
Yeah, sometimes people just need time.
That's right. Right.
Yeah, and the form locked their decision in time.
Right.
Whereas all the policies and practices and procedures leave the reopening of an investigation open to the victim's input. And those protocols really do, I think, cater to a victim-centered approach to these decisions that are so difficult. Recommendation 15 is to enact MOUs with all of our institutions of higher education. Mr. Vetter, along with our legal division, Meg Ferguson, took the lead on that, and we were able to actually draft a combined document that all of our institutions of higher learning education joined in that established these Title IX protocols and requirements. And we had discussed getting a copy of that MOU to be able to post to our Sexual Assault Task Force website. So we should look to do that after this meeting. Recommendation 16, staffing of the SVU. So many different things have occurred within the police department organizational structure that have really enhanced SVU's capabilities, resources, and staffing. We have backfilled some of the positions that were recommended by the task force with temporary assignments, reallocated and repurposed from other areas of CIB. And we continue to seek the overall or long-term fulfillment of those positions through the budgetary process. Chief and I were speaking last week about this just from the standpoint of we as an agency saw a decent number of retirements and continue to work to staff those. So at this point, a new budgeted position would be sitting empty for a period of time anyway. So the reallocation was really the best way to proceed with this. And as we move forward and move through COVID-19, we will seek to increase the overall budgeted strength of the department to staff this. We've created inventive ways to do this. We've had several really good interns through local college programs referred into us. We've had a couple police assistants who are retired law enforcement who have experience who can come and pick up the project right where without much learning curve. And we've also had a few volunteers join in the effort in a controlled way. And Jeff Ray, again, has created a situation where so much of the background work that needs to be done can be plug and play by people who can come and go. And so I think we've really, I'm really impressed and proud of the amount of resources that have gone into SVU and will be added in the future as well. 17, the increasing the communication between the state's attorney's office and the police department. John spoke to it on his side of things with the documentation and the staffing, but all the consultations that are done are documented through that staffing form. We have created a file sharing system so that when cases are staffed, rather than a prosecutor being handed a binder or a case to make a decision on, they are presented that case. It's shared with them electronically in whole before they're asked to even weigh in and make those decisions. If it's not provided to them in a timely manner, they defer that meeting until the next staffing. I think that really has created a much more complete and thorough review of the case before decisions are made. We did create this audio video teleconference room that's also able to review electronic evidence like cell phone records or audio video recordings so that that can all be done in the context of the collaborative effort and the consultations. So, John, do you have anything to add to that?
Yeah, only briefly, and I gave a lot of thought whether or not to say this part. I'm going to do it anyhow. The staffing is remarkably improved is not a fair comment because, I mean, for a significant period of time, the staffing and the communication has been good. I think back to way back in my day, well before this task force and well before the issues that we were dealing with in this task force, where often that communication was used as a way to get us to say it's okay to stop this investigation, which is not what it should be. But we at least asserted ourselves in saying that's not what we're here for a long time ago. And so now with this ability, the major improvement is the ability to get all this stuff, information and evidence to us in advance before that conversation occurs. And so it's even better than what it has been.
And Brian can probably echo from the police department side of that, the things that we put in place were the case file having to be there in place in advance and not a partial case file. The case file has to be reviewed and approved by a supervisor before it goes to staffing. You know, again, another thing that was occurring was the prosecutors were asking for additional police action, additional follow-up, and we as the police department recognized we're actually asking you to serve as our supervisors, and that was not what was supposed to be happening. So I think the processes that are in place now create, they take away some of those undue burdens on the prosecutors, and they create a more comprehensive investigation to begin with. So it's been a lot of work and a lot of back and forth to get to this point, and I think we've got a pretty good communication process and file sharing process in place.
I agree.
Yep. Recommendation 18 is about eliminating discretion that patrol officers have when responding to calls for service of sexual assault nature. Our policy actually didn't have discretion built into it. It actually called out sexual assault calls for service as one that gave no discretion. However, the actual practices in the field weren't matching. And John Skinner, who came in as a retiree from the command staff in Baltimore City, who's a professor at Tufts University, he showed us some calls for service auditing that he did in Baltimore City to help find those calls of a sexual assault nature that weren't documented that should have been, or that, you know, to be able to clarify whether they should or shouldn't have been. He was very complimentary of all the data we collected from our dispatch and showed us how to harness that data. So our special order really drives this home. I think it creates some better titling of police reports that allows for more appropriate titling as he recommended. For instance, the anonymous reporting safe kits at CBMC didn't have their own call title. They were labeled as suspicious conditions because that's kind of the catch-all. Well, that's not, we don't know what it is. We don't know what crime it is because we don't get the story. It's anonymous, but it's not a suspicious condition. So we created a safe kit delayed reporting titling, much more appropriate to what it is. And so I think the officers really feel like they have more appropriate checkboxes in the reporting system. I think the accountability all the way through the supervisors, through our training has really increased this. And then I think we'll get into the calls for service auditing that follow up. And, you know, if we're going to require it, we should inspect it. And that's where we're moving.
Yeah, I'd say, yeah, this was like I would say these two recommendations were like the leads recommendations, but what it really is meant to do is keep, you know, the patrol officer on the street from coding something and closing something that was a sexual assault, but just isn't visible to anybody to ever see, right? And even when we looked at the cases here, there weren't many things like that, but in some departments you will see like a whole pattern in practice around that. You'll see lots of cases just coded wrong. You coded in a way that you could never tell that the allegation was a sexual assault allegation, and then they just get closed and they never see the light of day. So, I mean, these recommendations are like very weedy meant to make sure that the practices in place and the policies in place, make sure that something like that wouldn't develop here ever.
And what we tried to do with our titling was kind of bring those calls that are confusing. Sometimes there's calls where we just don't know what they are, but they should be documented, then investigated. To bring them into the light, rather than calling them suspicious conditions, we created a title called Sexual Assault Pending Classification. And what we meant by that, if we know it's a sexual assault nature, we don't really know what crime category it falls into, if it falls into a crime category, but the word pending classification means somebody has to do something with it. And it made it searchable. And the semantics of it, if you were a victim who got a copy of your report later, you would recognize we planned on doing something with that when we took that report. And of course, after investigation, it would be upgraded to the more appropriate report titling. So it created more accountability for us. I think it also created more clarity for officers to more appropriately title reports.
Yeah, that's where the checks and balances come in to make certain, as soon as, certain verbiage is mentioned, whether the way it's dispatched or anything, that's an automatic flag. And that automatic flag means if I'm the supervisor going over, reviewing this report, watching the calls go and everything, I should be questioning when there's not the appropriate following of the policy here. I know in our department, we have that problem with respect to officers responding to a domestic violence call, knowing that they had to take a report if it's cleared as a domestic violence call and clearing it as disorderly conduct or something where a report wasn't required. And so the check and balance that we instituted was, okay, if it gets dispatched that way, is that supervisor checking to see, Thomas, you need to meet with me over here. Why did this get dispatched at this and you cleared it as this? There may be a legitimate explanation, but we know that when we're in this field, especially when we know that there is somebody watching, so to speak, we tend to do better, by what we're expected. And to me, it's just making people fall into good habits. A habit is a habit. Right?
Agreed. And so we created policy that I think makes that available. And then we created the supervisor response as well through our special order.
That's what you want.
19 is really getting into the weeds, the audit for the 911 calls and the calls for service. These are some really deep in the weeds, free word searches. John Skinner gave us some methodology. We have computer programmers that are working on that with our new RMS that are enacting these audits. And I'm convinced that we are finding the data that we need to find. Again, in the weeds as well was tracking incidents that occur at residential facilities, mental health facilities, and nursing homes. Not that those cases are in the weeds, it's the way to find that data. But through the new RMS, one of our elder abuse detectives took the lead and created a checkbox system where it becomes much more easily searchable because we plan for it up front. And we continue to monitor those. Recommendation 21, continue to go towards a trauma-informed, victim-centered, and offender-focused model. And this is both for the police and the state's attorney's office. I can tell you our organization's been infused with this from top to bottom. The chief has spoken to it at in-service training in conjunction with our training last year. It is front and center to all of our policies. We've created standardized definitions that are used across all of our sexual assault communication for those key terms. The buy-in with our training, particularly the leaves, using that leave presentation in any of our trainings takes anybody in the room who's kind of daydreaming and not engaged and really brings them right into the conversation. So we've infused that into the departmental-wide special order, our SOP, in-service training in 2019, 2020, our ongoing recruit level and lateral class training, as well as down to our unit insignia and the challenge coin. It really is more than a catchphrase for us in SVU. It really is how we live and how we work is through these models.
You as an agency are ahead of the curve on this, looking across the country and seeing what's out there. One of the reasons that DOJ just is approving this trauma-informed training modules that we developed is because everybody needs it yesterday. And frankly, a lot of agencies are looking to get this type of training, looking to bring this in, but there's just nobody to do it. But you are definitely, especially not only doing the initial training, but the fact that it's ongoing in nature. I've had the opportunity to talk to Sergeant Greenberg about the work that he's been doing and everything. It's very inspiring to see that that you all seem to be all in on this, because it is the wave of the future. And it's going to make things not only in areas of family violence and sexual assault and everything. That trauma-informed approach to everything we do is paramount. Somebody who's been in a car accident is traumatized. And therefore, interviewing them in a trauma-informed manner, we're going to get better information. You know, I'm sure you've had victims whose homes have been burgled, who have been more traumatized than some victims of persons crimes. And so it benefits the agency and the officer to be able to have this knowledge and to utilize these tools in everything they're doing. So I think you'll be more than happy with the results, and it's good to see the commitment to it.
My turn? It was funny when I was talking to Captain Edwards the other day, and we mentioned offender focused. My first thought was, when have we not been offender focused? Because, and it certainly has, as a general phrase, that's always been the case in terms of our prosecution with regard to these issues. I think that trauma informed and victim centered is an education that is continuing within our office and our prosecutors. Just as an example that I thought of when I was preparing for all of this and speaking with one of our prosecutors, from I don't know how long ago, we've always been focused on helping to explain why a child behaved in the way that they did when they were being sexually abused, and then calling upon expert opinion and or testimony to help explain that for a jury. Our eyes have become more open with regard to adult victims also. And that's something that we are engaged in when you get to the victim-centered part. Part of the difficulty in our function in all of this is, if we're talking about in preparation for trial, I truly believe that a victim needs to be prepared for that which is going to come at them during the course of the trial. And that's where it sometimes creates an impression that we're not victim-centered. Because you have to interact with that person and prepare them for the possibilities of what a defense attorney is going to do. And then we've got to be more attuned to making sure that the way that we communicate that is not one that is in any way accusatory, or that we're agreeing with whatever that attack's going to be, but be prepared for preparing the victim for that.
And I think that speaks to something, Amanda, and I actually wanted to speak to you about later, is the role of advocacy in that. The police department run into the same thing. When we're advising a victim, it can be coercive. When we actually belong advising them of something, same thing from your office. And so if an advocate is advising them if there's tough times that are coming, but saying, but I will be by your side the entire time, they can be doing it from a role of advocacy and not be perceived as coercive. So I know we have a high profile case that we've pushed through your office that's pending trial, where you've actually contracted with a national expert on trauma informed that's coming in. So I think that's valuable in educating the bench as well, is to have some model cases go through with somebody with the credibility of who you hire. So,
well, here, this is, the offender focus really comes from traditionally his criminal justice system. Time and time again, with this specific category of crime, we question what the victim's wearing, where the victim was, whether the victim is intoxicated, and so forth, without even interviewing the suspect, and time again. Whereas in other crimes, we are more offender focused. We don't ask the individual who was robbed at the ATM, well, why were you taking money out at that time? You should know better than that. All these types of things. We're not asking the bank why they got money in the vault. And so it's more so, and that's the attitude that whether we mean and have any intent, and that's the implicit piece. whether we have any intent behind that. What the victim hears is, this is my fault, or I'm being blamed for my own victimization. So the trauma-informed piece is so important. If I've got a victim, there are certain things we have to know in a case. I think we'll all agree. And if I've got a victim who's reported that she's been sexually assaulted, that she's been raped, and in the course of the investigation, we're coming to find that she took her clothes off during the incident. And I want to know, okay, I got to know why she took her clothes off. But I can ask it in a trauma-informed way, and it's not saying, why did you take your clothes off? Saying, man, can you tell me what was going on in your mind when you removed your clothing? That is received by somebody who's asked in that fashion a much different, in much more of a different way. They don't feel like the focus is on their behavior. And so that's where that goes to more in making certain that our investigative focus is on the behavior of the individual reported to have been engaged in criminal activity.
And I think that speaks to officers as well. Officers on the street, they just love locking up the bad guys.
That's why I said
We
the whole
focus them
system.
that way.
The whole system.
Yeah. Recommendation 22 is, we've already talked about with Laura. The SART is going to come together to conduct ongoing audits. I know the initial conversations existed between her and Lisa Dever of the State's Attorney's Office and Lieutenant Rupp. I'm confident that is going to move forward in the way the task force recommended. And recommendation 23 brings us to our audit. And I just wanted the last time we did an audit, we had tremendous administrative support from Catherine McMullen. She just did a great job of analyzing all the demographics and the case types and so forth and doing a random poll. We weren't able to get so technologically and statistically advanced, so we went and pulled every fifth case out of the logbook. When we realized only 39 of them would be eligible for audit, given the ongoing investigations, we then pulled every ninth to come up with a total of 50. So we have 50 cases that are pulled. Jeff Ray has those ready for us. Hopefully he's got like the safe kit from status, which was a common question last time. Some of the intended or the anticipated questions are ready to be answered, but we're also ready to look into any of the other questions that the auditors may have. As a closing to this PowerPoint, I just want to recognize for anybody that's watching in the public and even folks that are here and attending, and this is part of every presentation we make. This is tough information. This is traumatizing to some people just to hear it themselves, and it can trigger those that are watching and need emotional or support or advocacy. And we've asked Turnaround, and Turnaround gave us an email address for anybody that wants to speak out, has any testimony that they want to provide to the task force, any written commentary they want to provide, or if they need resources, they can reach out to Turnaround through this email address that's on the presentation, info@turnaroundinc.org. And there are just a tremendous amount of resources, both local and nationally, that are available, all pulled together on GBMC's website and also on the Baltimore County Police website that's dedicated to sexual assault. And these will be links and posted in the PowerPoint that will be posted on the sexual assault page.
So I want to thank you, Captain Edwards, for all your hard work putting this presentation together, kind of bringing all of us together, and to Drew for making sure we all got together, particularly in this incredibly challenging environment. So I want to thank you for that. I know Jeff Ray is on the call, and I want to, just acknowledge him and all the work that he's done, not only to support the audit process, but also just the work he's done internally about setting up systems. It's really been invaluable, and it sounds like it's a statewide model now. I want to also thank Catherine McMullen in her absence, who had such a huge role in, setting up the audit process. She actually reset up the forms and the database so we can use it again. I'm like such a proud parent in this respect. She is at my alma mater, Georgetown Law School. And if we'd met last week, she would have been able to be here because it was her spring break, but she's back in school. So I know, she wanted to be here and is thinking of us, but she did so much of the, kind of backbone work on all of this. So I just wanted to acknowledge her efforts and let you all know that she was so inspired, she went to law school. So good job. Before we close, I don't see any questions on the chat. I wanted to ask whether, first of all, whether there's anybody out there, who's watching this virtually, if there are any questions or that you wanted to raise in the chat, to feel free to do that. I also wanted to open up this. I think we've had a bit of a discussion, but if there's anything, based on these recommendations or anything that anybody wanted to raise as a question or discussion, I wanted to open up the floor for that.
There was one other item that was embedded within one of the recommendations that we covered about the BC stat process, covering some of the monitoring some of the implementation of the recommendations. I believe at the time the recommendation was made, we had just set up the office and may not have even hired a director yet. In the time that has passed, even through COVID, we now have a fully ramped up BC stat operation that is doing great work, both on the public safety front and across county government. Our director is an individual named Momin Abukdir, and he has a team that supports him. Among some of the things they've done is to put a crime data dashboard together, which is available on the county's website. And there's a lot of great information that's available there. And we have launched regular police data review meetings with the police department over the course of the last year. And at our last meeting, we covered some items within the report, just to check in on status. And that is a forum that will continue to exist for, periodic check-ins on where we are on these important issues. So I just didn't want to lose sight of that either.
And I think it's worth mentioning that statistics in the world of sexual assault are particularly dangerous. Agencies typically take great pride in reducing violent crime, and the statistics are kind of, we live and breathe by them. It can be very deceptive if the number of rapes and rape reports go down, because that could be indicative of us being coercive and not being trusted by the public. So I don't think those stats appear in the BC stat, although those conversations are always had behind the scenes and in-house. And so that bears repeating. If anybody goes to look for the forward and public facing statistics, you're not going to see a lot on sexual assault for that reason.
Anybody else? Okay, so I think the next thing for me to do is to I'm going to make a motion to close the meeting. Again, we're going to close the meeting in order to conduct the audit of the 50 cases that we talked about. There is an open meetings law and rules around closing open meetings for this purpose. And so there are two reasons under the open meetings law that pertain. One is to protect the privacy or reputation of individuals concerning a matter not related to public business. And another is to conduct or discuss an investigative proceeding on actual or possible criminal conduct. And so those are the two provisions that we believe apply to closing this open meeting under the Open Meetings Act. And so based on that, I'm making a motion to close the meeting for purposes of conducting the audit. Will someone second?
I'll second that.
Thank you. Everybody in favor, say aye.
Aye.
Anyone opposed? So thank you all, and thanks for everybody who called in or watched the live stream for the update. Again, I want to recognize everybody for their work and efforts on this. It's really been a great group of people working together and being really thoughtful on this, and I appreciate all the work that's been done to implement the recommendations. And with that, we can close the meeting.
Thank you.
Chief, I know you have to